When most people are first diagnosed with cancer, the focus is on treatment to give the best chance of removing the cancer. Typically, this is a distressing and worrying time for people. The expectation is that once treatment is over, they will be able to return to their normal lives. Luckily, with improving outcomes for most cancers, an increasing number of people get the good news that the treatment was successful and that there is now no evidence of the disease. While this is good news indeed, for many people this is another surprisingly worrying time. In early stages of cancer, with the best prognosis, doctors cannot guarantee patients that their cancer will not return or spread to somewhere else in their body. So, the experience of worrying and intrusive thoughts about cancer are common after treatment for people affected by cancer. In fact, it is estimated that up to 75% of patients report some degree of fear of cancer recurrence, and about half of cancer survivors report moderate to high fear of cancer recurrence. Over time, for most people, these thoughts subside. They adjust to the new normal and are able to dismiss the occasional thought of their cancer returning. These thoughts might become more frequent when waiting for scan results or before seeing a doctor or nurse. But most of the time, for many patients, these thoughts tend to be manageable. However, for some people, these thoughts are very frightening and hard to dismiss. In fact, approximately 1 in 10 cancer survivors become so fearful to the point where it becomes completely preoccupying. For this group of people who have what we call clinical levels of fear of cancer recurrence, their fear interferes dramatically with their life. In fact, they liken life after cancer to living in the shadow of a volcano. At any time, the fear can be that the volcano will erupt. They think it is important to listen to the worrying thoughts so that they can pick up a recurrence early and be successfully treated again. They also fear that if they give up the worry, the cancer will sneak up on them. These fears become so severe that people will either seek reassurance and check their bodies frequently for signs of recurrence, or they avoid contact with healthcare professionals altogether. The frequent checking and avoidance results in short-term reductions of the fear of cancer returning, but in the long term only exacerbate the fear. Research shows that people with severe fear have poorer quality of life and are likely to be depressed, use more healthcare resources, avoid follow-up care, and have difficulties in making plans for the future. It is for these reasons that cancer survivors have nominated help with managing their fear of cancer recurrence as their number one unmet psychosocial need. Australian researchers are leading the way to develop an evidence-based treatment for fear of cancer recurrence. This work is being led by Professor Phyllis Butto at the University of Sydney. Researchers developed a psychosocial treatment for cancer survivors with high fear of cancer recurrence, called Conquer Fear. Conquer Fear is a 5-session treatment program developed for use by clinical psychologists or psychiatrists working in the oncology setting. In a randomised trial in over 200 people with either early-stage melanoma, breast or colorectal cancer, Conquer Fear led to large reductions in fear of cancer recurrence and was more effective than other psychosocial treatment called relaxation training. The researchers also found that these participants remained less fearful 6 months later. Conquer Fear had 4 major components to try and deal with these challenges. The first was to look at a person's values and to set goals for the future. When people are preoccupied with cancer recurring, making plans for the future is difficult, and they often do not have the space amongst their worries to think about anything else. In Conquer Fear, therapists worked with cancer survivors to identify what was the most important to them and help them set goals to work towards. The second component was learning strategies to better manage worry. The programme includes a number of strategies to help cancer survivors break the vicious cycle of worry. Specifically, survivors are helped to develop an aptitude of detached mindfulness. That is, They are taught that thoughts and feelings are just experiences. They are not true. They can observe them without judging them. The idea is to see thoughts and feelings like leaves in a river or clouds in the sky. If you watch them and don't react to them, they simply pass by. Therapists also encourage survivors to postpone worry, that is, to set time aside in the afternoon, approximately 10 to 15 minutes, when they sit down and examine all the worries that they've had throughout that day. Over time, people learn not to respond to the worries when they occur. They also find that when it is time to worry, that the thoughts are not really worth worrying about after all. There is an exercise that survivors learned called attention training technique. This technique requires survivors to listen to an audio tape with many competing sounds to learn how to better control their attention, how to switch their attention from one sound to another, and how to divide their attention between more than one sound at a time. These skills allow people to build up their ability to control their attention, like exercising a muscle when you go to the gym. Together, detached mindfulness, worry postponement, and attention training helped survivors break the worry cycle. The third major component of Conquer Fear was to help people realise that worry is neither their friend nor their enemy. Many people think that it is really important to worry about cancer coming back to make sure that they catch it in time. It is true that people have to notice changes in their body, but they do not need to check every day simply because the cancer will not sneak up on them if they don't. Doctors set follow-up schedules based on the best available evidence to ensure that if there is a recurrence, it will be picked up in a timely way. So worrying on a daily basis does not protect people from recurrence. Others believe strongly that stress causes cancer. They worry that the worry itself will make the cancer come back, but actually there is not strong evidence that stress causes cancer or recurrence. However, stress and worry definitely make people less happy. When people are helped to realise that worry is not necessary, it is easier to let it go and use these skills that are taught as part of Conquer Fear. Finally, as part of Conquer Fear, for those people who check their bodies or perhaps do Dr. Google regularly, we negotiate limits on how often they go to the doctor, surf the internet, and check their bodies for lumps. Survivors often feel that checking makes them less anxious. Often this is true at the time, but we know that over time the need to check increases and the worry gets greater and greater in the longer term. By stop the checking, people can break this worry, check, feel, relieve cycle and realise that they do not need to check to feel less anxious. Conquer Fear is an example of an effective treatment for cancer survivors who fear their cancer recurring. But the problem is that there is an increasing number of survivors in Australia and a very small workforce of psychologists and psychiatrists who specialise in oncology. Even though we have a treatment that we know can be effective, most cancer survivors will not have access to a psychologist or psychiatrist. Many of them also do not see their fears as being a mental health problem needing specialist psychological treatment. In fact, we know that most cancer survivors would prefer to see a nurse to discuss these kinds of issues. This makes us wonder whether specialist oncology nurses could be trained in Conquer Fear. We have just completed a pilot study in Pasadena in the City of Hope Hospital in the USA, where 3 specialist nurses are trained to administer Conquer Fear to patients with lung and gynecological cancer, with ongoing weekly support from a psychologist. We changed the programme to 7 one-hour sessions, some of which were administered remotely via Zoom. We found that patients improved significantly on fear of cancer recurrence, anxiety, depression, and all aspects of quality of life. This makes us think that nurses are able and very well suited to delivering Conquer Fear. What we don't know, however, is whether in the Australian context, nurses would be willing to deliver an intervention like Conquer Fear. We also don't know how feasible it would be to train nurses in a 2-day workshop, and we don't know what all the barriers are to implementing Conquer Fear. Having heard about the programme, we would like your views on these important questions. Thank you.